Hi, my name's Mia. I'm one of the occupational therapists, and our role after your joint replacement is to see how you're managing with your everyday tasks like showering and dressing, and to give you tips to increase your safety and independence. We'll discuss your home environment with you and make recommendations for equipment that you might need at home. We'll usually see you about 2 to 3 days after your surgery, but if you're going to rehab, we might wait and see you closer to going home on the rehab ward. You'll have a form to fill in your pre-admission pack. We recommend that you measure your furniture heights at home, like your bed, your chair and your toilet, especially if you're having a hip replacement, as we'll have to make sure these are appropriate height for your hip precautions. In most cases, a standard toilet is going to be too low for the first 3 months. If you've had a posterior hip replacement and have hip precautions, you'll be unable to bend down to dress your lower body. We recommend you purchase a long-handled reacher to enable you to be able to thread your pants onto your feet. These items can be purchased from mobility shops, local equipment suppliers, and some discount stores, but be aware that prices and quality will vary. If you own a shoehorn, a sponge, or any other long-handled aids, you could always also bring these into hospital practice with while you're here. After a joint replacement, assistive aids like an over-toilet aid and a shower chair can make toileting and showering much safer and easier. You may or may not need to keep using these when you go home, so we'll discuss with each person individually on whether you'll need it or not. One of the easiest ways to source equipment is by hiring. Hunter Equipment Service is based at Wallsend Hospital. You can hire as many equipment items as you need, and it's $50 for 3 months. They do deliver to certain areas on certain days for no extra cost, but in most cases, you'll need to pick it up from Wallsend Hospital on a weekday with a referral from us. If you prefer to purchase equipment, there are a number of places you can do this, and we can provide you with local supplier lists and information, and your local pharmacy might even stock these. And driving, you're restricted from driving for a minimum of 6 weeks. Otherwise, you risk not being covered by insurance, and you'll need to seek clearance from your GP or specialist.